Good afternoon. Good noon to everyone who's joining. Hello. Please, we would love to see who all is joining for today's meeting. We would invite you to please put your name in the chat, your pronouns, and the names of the indigenous lands that you are calling in from. Thanks so much for joining us today for this second edition of the Just Transition Collective's monthly gatherings. My name is Michaela Stith. I'm the Climate Justice Director at Native Movement, which is one of the organizations that is part of the Just Transition Collective. And we will be hearing from some awesome Black and Indigenous leaders in our community seeking to illuminate health inequity in Alaska and also seek solutions that are based in our cultures. As new folks are coming in, welcome, welcome. We're so excited to see you here today. Please, we invite you to put your name, your pronouns, and the indigenous lands you're calling in from in the chat. We'd love to see who all is here. Oh, we have people all the way from Missouri. Thanks for joining us. So awesome. I see we have some Qs in the room. I'm a Zeta. Nice to see you. All right.
Nice to see you too.
Soon we'll get started. I'd just like to begin by saying that the Just Transition Collective works throughout the unceded territories of the indigenous peoples of Alaska. And we use the phrase remembering forward to recognize that in the transition that we're seeking to a more equitable society, we know that our communities have the knowledge already in order to transition to healthy, regenerative economies, and that Black, Indigenous, and people of color show us the path forward by illuminating the past. So these virtual gatherings become part of our Remembering Forward podcast, which you can find on Spotify and other listening platforms. And also all the resources that we'll be mentioning today will go out in our newsletter later this week so that you can stay connected. So please sign up for that if you have not already. They're available. The sign up form is available at justtransitionak.org. And while the perspectives represented here today are really important, we also recognize health is a vast topic that has many different pieces. And so working to create future opportunities to dive even deeper into this subject. Thanks everyone for putting your names in the chat. We're going to start out today with some presentations from, as I mentioned, Black and Indigenous leaders in our communities who are illuminating issues of health and figuring out ways to have healthy communities in Alaska. We'll allow everybody to give a little presentation, and then we can have some question and answers and dive deeper into how Black and Indigenous health is connected. So I'll first start off by passing it off to Celeste Hodge, who's with the Alaska Black Caucus. She'll talk to us a little bit about the Betty Davis African American Summit that just passed and about Alaska Black Caucus's ongoing work. Thanks so much for being here with us.
All right, thank you so much. I'm really excited about this opportunity, and I want to thank, first of all, Glow for this invitation. Thank you so much. And I see so many allies out there, Rebecca, and I see Rich, and if I kept naming them all, we'd be here all day, but I want to thank them for being here, because I know they could be anywhere, but they chose to be here. And so thank you for that. So a little bit about the Alaska Black Caucus. The Alaska Black Caucus was formed in the 70s. We reorganized in 2019. We saw a need to do real work within this community as things were happening, things were unfolding. The Alaska Black Caucus, as many know, is a very active organization with an ambitious agenda. We champion, in a nutshell, the lives of Black people and other people of color in 4 core areas: health, education, economics, and justice. We're dedicated to achieving a safe and equitable Alaska for our people, for our communities. And we're really excited about the opportunity that came forward recently for us to purchase a building. We're calling it the Equity Center, and we know that real work will come out of that center. But honestly, this is a very exhausting position. It's very exhausting work that we do because the challenges are real. And, as a volunteer organization, the issues don't stop. I'm very, like I said, very fortunate to have a dedicated board and individuals that help to do this work. We are out there in the trenches. We are just about everywhere. Sometimes I get comments from people that share that it's hard to believe that we are a volunteer organization, that no one receives payment for the work that we do. There is opportunities, though, when we are fortunate to secure a grant, and then with that grant, we're able to do work related to that grant. But outside of that, we're all volunteers, and we do this work because of the passion that we have. I know for me, I've been engaged in this type of work for a long time. I started, and I just about every time I tell the story about the beginnings for me, I get really teared up because life isn't always easy for people of color. And I think about my days when I graduated from high school and I went to work immediately within the with the municipality of Anchorage. Out of more than 100 employees, I was the only person of color, Black person, that worked in this department. And I was subjected to discrimination to no end. And I remember being told the reason that I could not get promoted. Now, I served in an entry-level position for nearly 2 decades. And I remember being told I could not receive a promotion because I did not have a degree. So I went back to school and I got my degree. I first got an associate's degree, and then I received my degree in social work, bachelor's degree in social work. And I remember, coming back and asking or trying to get promoted, and still the same response. But I would go on to train individuals who did not have degrees, and they would become my boss, and then they would get promoted without a degree. And so I just felt that I needed to do something about that. I remember bringing a complaint forward to the Anchorage Equal Rights Commission, and it went nowhere. And then I went to the local NAACP, and they didn't have the resources. And so what I did was I ran for office within the NAACP, and I became first vice president, and I ran again and became president. And I served as president of the NAACP for nearly a decade. And the only reason I moved from that position is because a door cracked open for me when Mark Begich became mayor, and he recognized all of the work that we were doing when he served on the assembly, because before he became mayor, he served as an assembly chair and an assembly person. And at any rate, to make a long story short, he promoted me. He promoted me to his cabinet. And sometimes all you need is an opportunity to show your self-worth, to show that you are more than what many or some might say that you are. You can do more than an entry-level position. I'm not knocking entry-level positions. I'm just saying, sometimes when given an opportunity, you can bust the door wide open and do the rest on your own. So I just wanted to share that. And the other piece to this is, I believe, for me, my passion comes from living in that environment and not wanting to see others ever have to deal with that situation. And so I do this work, yes, as a volunteer, but at the same time, there are others along with me, like our Allies for Change group, who support our mission, support the mission of the Alaska Black Caucus, and help us to accomplish our work. And so I know that we only get like 10 minutes. I do want to ask Dr. Amana if he can share a little bit about what the Health Committee is doing. And let me just say really quickly that the Alaska Black Caucus has 4 core committees. We have the Education Committee, the Economics Committee, the Justice Committee, and the Education Committee. And Dr. Amana is the co-chair of our Health Committee. And really quickly, you know, before the murder of George Floyd, the Alaska Black Caucus was not successful at securing funding, period. We would have to go through unbelievable documents to try to get $500. But after the murder of George Floyd, we were successful at securing a grant. It was a COVID-19 grant. There's a lot of issues surrounding our health, and Doctor's going to talk about that. But we were successful at securing a grant. And with that grant, we partnered with the University of Alaska, and we were successful at completing the first Black Alaskan health needs assessment. Long overdue. We were tired of being lumped into other categories, other groups. We wanted to know where we stood as a people, as Black people. And so I want to go ahead and ask Dr. Amana to take it from here.
Thank you, Celeste. Yeah, absolutely. So how much time do we have?
Did I take it all? Sorry.
No. About 5 to 10 minutes.
Okay, all right. Yeah, so thank you. Just to follow from what Celeste has described, so I'm chair of the Alaska Black Caucus Health Committee. And in the committee, we try to, sorry, it's my phone going off here. Address issues that are health related and specifically within the Black community. I think perhaps some of you might be aware that we were part of the Betty Davis event summit, where we talked about the work of the committee, but specifically referencing the health needs assessment that we conducted last year. That is one part of what the health committee does. We also do a number of health events. Looking forward, in June, we'll have a health event around the Juneteenth, so June 19th, June 18th, to highlight the health needs within the Black community, but also largely within the BIPOC community as well. We're also working on a podcast. It's really about how do we then get the information out there. We have a Black Alaskans Health and Wellbeing podcast, which I host. I am also inviting people to reach out to me. I'll put my email here. If you'd like to speak about, I talk to people about health in general, as it relates to the Black community, but also the BIPOC community in general. We want to know about what you're doing to address health and health challenges within your community. So part of the work that we did last year was the health needs assessment, which as Celeste has talked about, prior to COVID, right? If there was anything positive to come out of COVID, was the recognition of the disparities that the health disparities within the BIPOC community, right? That suddenly it dawned on America that Black people and people of color in general have disproportionately been impacted by health. So we talked about social determinants of health prior to that, but that message didn't really sink until, as Celeste talked about, the murder of George Floyd, but also the pandemic itself. In fact, some people have referred to these two, sort of the murder, the police brutality, and the health challenges as the syndemics, right? These double sort of pandemics that came together and really amplified the challenges within the BIPOC community. And so it was in that context that the Alaska Black Caucus put together this application to then say, we need to understand what are the health needs within the Black community. We know that Black people and people of color in general were dying at a higher rate than the white community as relates to COVID. But there was really no hard data to prove that. Within the state of Alaska, we didn't know what were some of the health challenges within the Black community. And so that was sort of the context that led to the us working with the Alaska Black Caucus to conduct the health needs assessment. And within that assessment, what we really wanted to know is what are those health challenges within the Black community compared to other racial and ethnic communities in Alaska. And so we looked at data dating back to sort of 1995 to 2020 to really understand the secondary data and population level data that was available to really say, what are those health challenges? So if you look at the report, and I don't think we have the time here, but we do realize a number of areas where Black people have significantly more challenges compared to the white Alaska Native. We also compare to Asian Pacific Islander communities, right? So to basically say, if we want to address health challenges within the Black community, this is what we need to be looking at, right? And so we have that data. It is there. Is it entirely perfect? No. Small case numbers, then you get into the whole challenges about to what extent can you generalize statistically, given the sample size. But at least the secondary data is there. But we also did some primary data collection. We talked to Black people, we surveyed the Black people, and we found about 674 people who responded to our survey to tell us what the Black community is dealing with. So we have sort of that, if you will, two approaches to sort of validating our data. And so we are confident to then say, these are the challenges within the Black community as it relates to health compared to other racial and ethnic communities. So what are those briefly? Can I share my slide? Or I'm already out of time. How much time do I have?
You should go ahead. Glo, is it possible to share slide?
Let me see what I can do. Give me one moment.
All right. Otherwise, I can just talk through and then I can share the link to the report as well.
I think you should be able to
Okay.
share your screen.
All right. Yeah, there you go. Okay. So all right. Sorry, I'm just gonna. So what are the health needs? Sort of the major health challenges within the Black community. So overall, we asked respondents or Black people, what are some of the what are their own perceptions of health? In other words, how do you rate yourself in terms of health? And so in general, what we find is that Black Alaskans in general reported that their health was excellent or very good compared to others. However, when we look at it on average, we find that Black Alaskans reported more days on average where their physical and mental health was not good. So you can sort of see this on average number of days. Generally, they report that their health is not good. So in terms of their physical and mental health status, on average, again, we see this as sort of graphically here, that Blacks reporting more days where they feel their physical health is not good. The same applies to sort of the mental health, right? So again, this helps us to think about both physical and mental health. And then we also wanted to explore some of the morbidity-related, mortality-related factors. So what we find is that more Black people have lower rates compared to other groups in terms of suicide rate, right? So as a cause of death. So again, why is that? I think that's a positive message, but perhaps does that relate with what we are now finding out about suicide rates that are actually increasing, right, within the Black community? So compared to others, what we see is that these are the leading causes of death within the Black community, right? Pretty much similar across the racial and ethnic groups, but what we see is that suicide being reflected in the other racial and ethnic groups, but not within the Black community, but definitely cancer being across the board for all the racial groups, heart disease again, but number 5 here is diabetes, and we have specific programs that we're going to talk about as it relates to addressing diabetes and other causes. So this is what we find. Cancer, similarly, we have Black Alaskans having a higher likelihood of death from cancer, especially of the reproductive, female reproductive system in comparison to other ethnic groups. So real disparities there in terms of the outcome, even though what we find is that Black Alaskan women actually have higher rates of screening, right? So you would think that should be preventive, but it isn't, right? So you see that more are actually dying from cancer despite the higher screening rates. So again, this is just a summary of the specific sites. As I said, the reproductive parts of the female. And then infant mortality also being higher within the Black community, right, compared to the other racial and ethnic communities. So yeah, so here what we're seeing is that even though as it relates to cervical cancer, for instance, Pap smear rates are higher, they're getting a higher rate, but this kind of then doesn't translate to having better outcomes from it, right? So that's just a summary, and then of course I can go into diabetes and heart disease as some of the areas where we are seeing the problems. But the question is, what are we doing about it? Right now that we know, what are we doing? So we have put in an application for some funding that can help us to address these challenges. And so if all goes well, we're expecting perhaps some funding around that will help us to deliver interventions at the the equity center, where we'll address sort of chronic health within the Black community. And so this will be an NIH funding if it goes through. But we do have those initiatives coming. But in general, trying to address diabetes, we are also partnering with the diabetes, it's called Project Power project, which would help us to address sort of factors related to diabetes within the Black community. So these are some of the initiatives that at least are coming out of the report, the assessment report. Now thinking about what can we do in order to address these factors. And even though we talk about the Black community, we think this is actually true for all BIPOC communities. So this is also a call to all join us in addressing these challenges within the Black community. So that's in a summary, and I'm sorry I did go over time as always.
Thank you, Dr. Vise. You have a lot to share, and we really appreciate you sharing it with us. And I'll be interested in the question and answer to hear about the connection between both of these folks here from the Alaska Black Caucus. We hear about these health outcomes and also the discrimination that we see day to day and how those interact with each other. But for now, we'll start moving on to our next speakers. We have Dr. Allison Kelleher talking about Indigenous perspectives in medicine.
Hi, everybody. Allison Kelleher, Manoy Lake Hase Uza. I introduced myself in Danakanaga, or our Dana language, our Koyukon Athabascan language. My mother's originally from Nalahado, and I follow her clan line. We are the King Salmon people. Tlege Hutanetslan Tunidzagatsipni Te Hutanetslan Nalahado Hutsan Sedon Salet. We're originally from the upper Inoko River. And that's kind of a region between Nome, where I was born, and the people of Coeric, and Fairbanks, where I went to undergraduate. I'm currently a family physician, also board certified in integrative or holistic medicine. And I was trained by my elders and family to be a traditional healer. I've worked in clinical settings, from the Indian Health Service to tribal settings, including South Central Foundation in Anchorage. And I've also owned and operated my own clinic called Snow Creek Medicine. I'm currently speaking to you from the Piscataway and Susquehanna territories, the unceded territories that are in Baltimore, Maryland. I moved last week to Johns Hopkins University, where I am pursuing an opportunity to help elevate Indigenous voice into medical education, and so med ed, as we call it. So I'm working at the School of Nursing in conjunction with the Bloomberg School of Public Health, Center for Indigenous Health, where there are several initiatives that I'm working on. One is to increase awareness of the potential that good could come from traditional healing practices, and awareness of other global healing traditions, including lots of things such as biofield or electromagnetic medicine. I'm particularly an advocate for plants and intact ecosystems, senses of belonging, and other less tangible but just as important methodologies for promoting health and wellness. I'm an Alaska WAMI, which means that I went to the University of Washington for medical school, and I still try my best to teach there at UAA and also at UW, where I've created a curriculum called Decolonizing Medicine that's become relatively so popular, if you will, that now it's being taught in all 5 states. So that's Washington, Wyoming, Alaska, Montana, and Idaho. And then I'm working on decolonizing curriculum at the School of Nursing and the School of Public Health here in Baltimore. So I have a couple of large tasks ahead of me. I don't want to digress too much about myself. I want to mention that we have another friend and colleague here who's working on birth workers and traditional birth workers. They're a tremendous ally and asset in the landscape of an ecosystem of the Alaska health system. I also want to acknowledge the Alaska Black Caucus, and I have collaborated on a podcast a couple of years ago regarding the importance of perspectives and diversity, particularly for those, for us allies to come together to raise each other's voices up. So I just want to acknowledge my friends there, and acknowledge my teachers and elders. Alaska Community Action on Toxics also has been wonderful support over the years. So I just want to thank you for allowing me to be present, and honor that. Abra, I'm happy to hear you share now. Masi Puyanakpak.
Koyanakpak Thank you, everyone. Yeah, thank you, Allison and Amana and Celeste, and then we'll hear from more people after me too, but yeah, so I'll introduce myself. Uvanga Nungasuk, Utkiagavik Mugarunga, Patkatat Kuyagarunga. My Inupiaq name is Nungasuk, and I'm Inupiaq from Utkiagavik, from the Patkatuk family. And I live and work in Anchorage on Dena'ina lands. And I'll share about Alaska Native birth workers community and how we kind of came to be. We saw a need. It's been there for a long time. So many Alaska Native people are forced to evacuate from their home communities while pregnant at 35, maybe 36 weeks, maybe earlier if they're deemed a high risk pregnancy, and they have to often go to Anchorage or another hub community, leave their home, and a lot of times they're alone. So we, and by we, I mean, there were 6 of us initially. So Margaret, David, Nina Jacobs, Charlene Uppuck, Stephanie Cromarty, and Stacy Lucasen. Years ago, we just started kind of organizing and thinking like, what can we do to support these families who are going to be here alone? And we started out just volunteering time. If we learned of someone who needed support during their birth and we're delivering an ANMC and might like not have anybody with them, then we would be able to go and be there at birth. And all of us kind of had some background in birth work. We're passionate about this. And then we eventually formed an organization. So now like we have grant funding and we have doulas who do this as their job. I was the first one. I've been a doula for almost 13 years now, and I ran the prematernal home in Barrow for 5 years. And I met Lena and Margaret at a conference in 2014. And then we just, over the years, it's hard to say exactly when, but I started on in fall of 2021 as the first full-time Indigenous birth worker and doula. So I accompany people to their appointments if they need it. We do prenatal care, we do preconception care, we have talking circles, and our goal is to be there for Indigenous families who are alone. At first we thought like, oh, Alaska Native people from rural Alaska, but we are not part of the healthcare system. We're not like associated with Alaska Native Medical Center. That's where we are a lot of the time, but we can also go to births at home. We can go to birth center births. We are able to go to Providence, like anywhere where people are. And our goal, we have like 3 tiers. So we want to like train more birth workers so that there's people in every community in Alaska to support people, to support families. And then we also have our direct service, which is being there for families, one-to-one care. Like I'm able to support, I guess the example would be like if someone reaches out for support in like, and they're like 20 weeks pregnant, I'm able to meet with them for prenatal visits. And then when they go into labor, they just text or call me and I can meet them wherever they're at, whether it's hospital, home, or birth center, and be there with them for their labor. And then we also offer in-home postpartum care. So it's been really amazing, really special to see the kind of connections that have been formed through the work that we're doing at Alaska Native birth workers community. And our 3rd tier is like system change, like looking at like how can we make the systems better for people, like policy work, recommendations. And I do also volunteer on the maternal child death review committee with the state of Alaska. And I've learned a lot through that, like of where we're really failing our people. And the MCDR committee reviews all deaths within 1 year of birth. So we, and by we, I mean the panelists who are selected for the review really go in and look at like, where could we have done better? Like, how did we let this person down? Was it possible to change that outcome? And that's also been really enlightening to kind of understand, like we are letting our people down in a lot of ways. And Black, Indigenous, Asian, Pacific Islander, Hmong people have higher rates of maternal mortality than white people do in Alaska. So community-based work is so important to change those numbers around. Looking at numbers and like statistics like Dr. Amana was sharing, like we need to know these facts so we can really figure out what we can do to better support people. And a lot of people after they have babies are also at a higher risk of suicide and also of getting murdered. So there's just ends up being more violence. And it's hard to say. I mean, there's lots of reasons why it's stressful to have a change in the family. It's stressful to have a new child. Also, people after they deliver, they have to travel when they're going back to their rural community. Alaska is so unique, and most people are not expected to get on multiple flights with this tiny little 3-day-old baby, and then get back to their community and deal with all of those adjustments. So our goal is just to support people as much as possible so they feel empowered and they have community connection and support during pregnancy, and also to kind of reclaim ceremony around childbirth too. But there's definitely so much more work to do. I will share, like through the collaboration with the state of like the MCDR committee, there's a wonderful ally and friend, Ness Varigan, who recognized how important doula work is. And so Ness worked out a grant, a program that is being piloted through, and Due North Support Services, Delicia Young, she is Black and Inupiaq, and so she actually has that grant through the state of Alaska and is able to support more community members for birth. And she's paid through the grant and then is able to provide those services free of charge. And Alaska Native birth workers, we don't charge any money for any of our services. We're just there for families who request support, and then we're paid through our grant money. So it's a little bit about our work, and it's just been really amazing, really exciting to see how much it's grown and how much it will grow. And it really is just like for our community, and I love it. So yeah, thank you for this time and allowing me to share. And I look forward to chatting more about this. Tavra.
Thanks, Abra, and thanks to all the speakers so far. I just invite everyone to take a deep breath. This is all personal and hits home for a lot of us. And so we have to give ourselves some grace as we carry on to our final speaker, Pamela Miller from the Alaska Community Action on Toxics, to talk about environmental justice in the state.
Hello, everyone. Good afternoon. It's really an honor to be with you and to be with all these wonderful speakers. And I just thank Glow and Michaela and everyone for organizing this event. Really appreciate it. Yes, my name is Pam Miller, and I am the director of Alaska Community Action on Toxics. And we've been around since 1997. We're an environmental health and justice research and advocacy organization that works statewide on research, community-based research and advocacy to prevent harmful exposures to toxic chemicals, whether from military contamination, mining, oil and gas, or contamination of the Arctic, because we now know that the Arctic is a hemispheric sink for many of these industrial persistent chemicals that are arising on wind and ocean currents and accumulating in the bodies of fish, wildlife, and people of the North. So our efforts are really focused on prevention, and not only to do the research, and the science is important for sure, but to change policies so that our system of law is truly protective of the most vulnerable among us, women, children, and workers, and those who rely on traditional foods that may be contaminated with these chemicals that are coming into this region from many other places throughout the hemisphere. We work also to hold the military and industry accountable for stopping pollution where we can, to enact stronger laws to prevent the releases of these chemicals into our waters, into our air and lands, and also to prevent the health disparities that are preventable. And we know that many of these diseases that are linked with chemicals are preventable diseases. But we now know that with all the science that's been done, chemicals can have effects on our bodies at very, very low exposure levels. They can disrupt our endocrine system. They can cause harm to our thyroid and reproductive systems. They can cause metabolic diseases as well, and certainly cancers. So wherever we can, we work for prevention. And I would be remiss to not say a little bit about how I came into this work. I'm originally from Ohio, and my family heritage is Irish, Scottish, and German. And I was born in a small town in Dover, Ohio. And it happens that that's the site for a very large chemical manufacturer called Dover Chemical that contaminated our neighborhood, the waters, local farms in our neighborhood. And my mother was a nurse, and she began seeing patterns of illnesses in our neighborhood, particularly cancers, and began asking questions. And I think that's really, I want to recognize her today, because I think I came into this because of her questioning and her interest in preventing harm from this very polluting facility in our own community. And it turns out the chemicals that are manufactured in my hometown, unfortunately, are among those chemicals that are now accumulating here in the Arctic. And it's a very large class of chemicals that most people haven't heard of, short chain and medium chain chlorinated paraffins that are used widely. They're one of the most largely produced chemicals in the world, used in the manufacturing of plastics, pesticides, and other products. So Alaska Community Action on Toxics actually came about because of women that were also noticing harm in their own communities. And I want to acknowledge them as well. Annie Aloha from the community of Savunga on Sivokak, or St. Lawrence Island, was a health aide. And the health aides really are the front line of the healthcare community here in Alaska, I think, as we all know. But Annie began to witness health disparities that she associated with the former military base at Northeast Cape on Sivokak. And these included cancers, reproductive harm, and birth defects. And she became alarmed and tried to get help from many different agencies for many, many years. And I had the opportunity to meet her in 1997 before she herself died of cancer. And she asked those of us to carry on. She said, "I will fight until I melt." And she asked us to carry on her work respectfully, to do community-based research to really understand what was happening. And so over the years, with support from the National Institutes of Health, the National Institute of Environmental Health Sciences, we've been able to do community-based research out there for many years, have published over 20 papers, and I'd be happy to share any of that work. But we've documented the harm caused by the military, which was because there was a very large base established there in the 1950s that operated into the 1970s. And when the military left there, they left a legacy of hazardous waste that included PCBs, pesticides, and heavy metals, as well as solvents, and a huge quantity of petroleum that spilled into the Suki River there, which was once one of the most productive streams on the island for fish, and the coastal area for seal, and that entire Northeast Cape area for plants and traditional medicines. So what we're doing out there is not only documenting the harm caused by the military, both to the people there, and we have documented higher levels of PCBs in the people, but also documenting the harm to the waters and to the land and to the plants and the animals in the region. So we've done community-based work there for over 20 years, and I just got back late last night from Savunga, where we're doing a new project, not a new project, but a project we've been working on for a few years called Protecting Future Generations, because the community leaders, the tribes out there, asked us to look at how these chemicals might be affecting the children in the community. They were concerned about learning and developmental disabilities that they began witnessing in the children there. So we're working with children aged 2 to 12 to look at how these chemicals might be getting into their bodies and how it might be affecting their health. So I got back late last night. We were weathered in for about 4 days, which was great. So I'm just getting my feet back on the ground. But I wanted to talk a little bit about that work, about the work we're doing locally, nationally, statewide, and globally on policy as well, because we have to change the laws that are badly broken, because they're not protective of the most vulnerable among us. And so we're working locally to hold the military accountable. We're working statewide to get chemicals out of our air, water, and food. Nationally on another broken law called the Toxic Substances Control Act, as well as the Clean Water Act and Clean Air Act, to make sure that these laws actually do what they're supposed to do, which is to protect public health. And internationally, we're working on a global legally binding treaty known as the Stockholm Convention on Persistent Pollutants, because these chemicals don't respect political boundaries, and they are traveling hundreds and thousands of miles and accumulating in the Arctic, as I mentioned. So we can't just afford to work locally to get chemicals out of our schools, out of our communities here locally. We have to work on an international level, because these chemicals are manufactured and then transported on wind and ocean currents here. So we're working to ban chemicals globally under the Stockholm Convention, and actively working on a number of chemicals right now, including a class of chemicals that are extremely persistent and toxic. They're known as forever chemicals, or PFAS, per and polyfluoroalkyl substances. So we've achieved some global bans on those chemicals, as well as a number of other chemicals that are accumulating in the Arctic. And I'll say one other thing briefly. We're working right now on a law here in the state to eliminate a class of chemicals that I mentioned called PFAS, per and polyfluoroalkyl substances. And these are chemicals that are very widespread in the environment, in our homes, in our bodies. 98% or more of us have PFAS in our bodies, and they can cause harm at extremely low exposure levels. Here in Alaska, many communities in our state have PFAS in drinking water because they're used in industrial firefighting foams that are used on military bases and on airports. So communities from the far north of Alaska down through southeast have contaminated drinking water because of the dispersive use of these PFAS in firefighting foam known as AFFF, or aqueous film forming foams. We've done a couple of investigative reports, which I can post on the chat, about these chemicals, but we're also looking to pass legislation that would phase out the use of these chemicals in firefighting foam, because there are many safe alternatives. And then also to get stronger provisions to establish health protective drinking water standards, to prevent the incineration of these chemicals, because that just distributes them up into the atmosphere, and also to protect communities that are already contaminated by providing an alternative and safe drinking water source, among other things that we're working to achieve. So if you'd like to get involved with that, we'd love to have you be a part of our efforts. There will be a hearing on our bill, SB 67, on Monday. So would love to have folks join and testify in support of that bill, and also in support of strengthening that bill. So I think I'll stop there, and certainly welcome any questions. And again, thank you so much. Really appreciate being a part of this.
Thank you, Pam. I will mention that ACAT, Alaska Community Action on Toxics, is a core collective partner of the Just Transition Collective. And we're always looking to expand our partnerships, either as an organization to be part of hosting events like this, or as tables to be advocating for policy change, or just as project collaborators. So if that's of interest of you, definitely head to our website, We already have a question in the chat. I invite everyone to add the questions that they have, and I know I have some that I will ask as well. But just to ask this first question, Pam, is your organization getting support from our senators, especially given membership in the Senate Armed Service Committee?
Yeah, thank you for the question, Richard. Not so much help yet from Senator Sullivan. I would say, he's tried to do some things, but really very limited support for some of the stronger measures that we've sought through the National Defense Authorization Act. He has not been a great advocate, to say the truth, and his family is connected with the chemical industry, and he seems to be beholden to the chemical industry in many ways. On the other hand, Senator Murkowski has been actually quite helpful in some ways. We certainly don't agree with her on everything, but she really supported a measure to eliminate PFAS from food packaging, which is another major source of PFAS exposure in people. So she's been very helpful, and we continue to work and to try to educate the Alaska congressional delegation on the importance of these issues, the importance of taking action at the federal level. But things are moving very slowly, I'd say, at the federal level, which is another reason why it's so important for states to step up to protect the health of our people here.
Thanks so much for that answer. I'll direct the next question to all of the folks who are panelists here. How can we get involved with your work, whether virtually or in person? We all want to know more. And anyone can take that question first.
Well, I'll start first. All you have to do is visit our website, thealaskablackcaucus.com. There are opportunities. You can learn a lot from our website. Again, there's those committees. We have events and projects that are ongoing. In fact, as Dr. Amana mentioned, upcoming is the Juneteenth in the Park Strip, on the Park Strip, and we are taking the health component piece. And so, we're expecting it to be a large opportunity this year for Juneteenth. And we would love, as you shared, partnering. We would love to have all the health professionals, organizations come and support this work and get this information out in a large way to our BIPOC communities. So visit our website. Thanks.
Perhaps, Pam, could you share some ways that folks could get involved with your work?
Sure, thank you. Yes, also through our website. There is a lot of information on our website, as well as ways to get involved through volunteering. We have tabling opportunities as well. We currently have a petition that people can sign for clean water, which helps to support the legislation that we're seeking this session. And yes, we just welcome everybody to get involved. If you would like information, would like to volunteer, would just like to testify, or know how you can get involved in supporting the legislative efforts that we're working on, please contact us through our website, or certainly email as well. And I'll post some connections there in the chat. Thanks.
And Abra, how would someone get involved with the birth workers community or receive your services?
Yeah, I shared some links in the chat, and I have one more that I was just pulling up. So if you are Alaska Native or Indigenous and pregnant or wanting support around like preconception, pregnancy, birth, postpartum, here is this link about the services we offer. I also shared about how allies can support our work. It's all on our website, nativebirthworkers.org. We have events too. So we do talking circles every other week. And then we have trainings. I don't have any coming up soon, Oh yeah, Facebook, good point. Celeste said, like the Alaska Black Caucus on our website. Social media, we have a Facebook page that we're active on. We have a newsletter that you can sign up for on our website that I think comes out once a month, that definitely will keep you updated on our events. If we're having trainings, we do childbirth preparation retreats for Native families every other month, and those have been really special. So just, yeah, check it out on our website, check out our events page, and sign up for our newsletter and connect with us on social media as well.
Thanks. And I see Allison, Dr. Kelleher put some links in the chat as well.
Yeah, that's all right. So I was thinking about, the advocacy that can be done, and recently wrote an article in collaboration with the Conversation publication. So you can see a link there where I'm trying to explain as gently but truthfully as possible, which is a hard thing, the truth of the underlying disparities that Indigenous peoples face globally, but particularly locally, right? And there's a couple of other resources I chatted in. The Center for Indigenous Health here at Hopkins, which has existed since the 80s and is doing wonderful work to partner with and hire folks as myself to lead the health initiatives in our country, but also globally around Indigenous health issues. The United Nations Permanent Forum on Indigenous Issues is meeting in New York in a couple of weeks in April. And so we've written a Indigenous Determinants of Health paper that we'll be presenting at that event. I also just want you to be aware that there's an American Heart Association or a special populations subcommittee that's wonderful to get involved in also as far as advocacy. And I sit on that subcommittee in addition to the Association of American Indian Physicians. So I just want you to know that I'm trying to do the work, and also published a chapter in a recent textbook out of the University of Alberta Press. And I'm doing the work for all of you and for our ancestors and elders, right? So here's my email, my new email, at jh.edu. So in case that is helpful for us to keep in touch. And I just want to thank you all for the space and time. I think it's just, the opportunities are tremendous. So it's easy to look at, the negativity, I think, that surrounds us and unites us in some ways. But the truth is, the strengths-based approach and optimism is what's helped me to be able to bear that tension, right? Especially working with us as individuals or with our communities and the challenges that we face. So thanks so much, everybody.
Along those lines, I have a question. And of course, if anyone in the audience has a question, please raise your hands or drop it in the chat. But as a Just Transition Collective, we definitely look forward to those strength-based approaches and try to highlight what people in Alaska are already doing to live in a more liberated society, a more healthy society. Of course, we recognize that the reasons why we might not be healthy or not have as great health outcomes are rooted in racism, rooted in colonialism, and we want to be able to change those parts of our society and transition to building the good. So I'm wondering, from all of our panelists, in what ways could our society be different in order to have healthier outcomes? Or what do you think are some successes and new ways, good ways we're trying to build forward?
So for me, it's about uniting and partnering and working together to move the needle, because it's hard to do it in isolation as one group. I mean, the forces are too big. And in order for us to really move in the direction that we have not seen thus far, I really believe we need to come together more, just like this forum here. I love this, the fact that I have met. I'm already taking all these notes like, okay, I need to contact them. I need to make sure. And I see Dr. Amana's over there doing the same thing. I've learned so much. And it's not like I've not been here before. I mean, but so just this connection right here is invaluable. So I thank you for this opportunity. And sometimes you have to make the time. We're so busy, you know, but just look what we've learned right here, at least for me. So thank you. I think collaborating more is key.
Yeah, just to follow up on that, actually, I didn't know about the just transition, right? This is my first time, and as a collective right here, I didn't know about this. In fact, when we were doing the assessment, one of the things we were talking about is how do we create such a forum, a space for BIPOC equity, health equity related group. Little did I know that it already exists, right? And so I think communicating and sort of utilizing already what exists. There's a lot already that exists, but we perhaps do not know, right? And think that we tend to move towards creating instead of curating what already exists. And I think this is a good example that, you know, we already have these mechanisms and structures in place. How can we just use them? And so let's share more information and work together. So I really appreciate that you have started this, because this is the kind of space that we need.
Yeah, and I'll jump in and share. When thinking about health equity, because that was the overall panel, or the topic, the overall banner of this conversation, to just remember how the systems that are in place are designed to keep us sick and really be very critical in the ways we think about people receiving care, and care I want care providers and systems to acknowledge that, like, that historically BIPOC people have been their genocide, slavery, thinking of like the ways we've been just the losses we've experienced. So today's medical system is not adequate, and it's also like still killing us. So it's still like when Dr. Amana shared those the illnesses that people suffer from, it's like we need to be really honest that like the systems are racist and they're still actively killing us. So really confront that. And when doctors say things like, I recently asked in another panel, an echo panel, what can we do to increase access for prenatal care in rural Alaska? I kind of knew the answer, but I was really curious what she said. And she said, well, if people aren't getting prenatal care, then it's because they don't care about their health. And that just flowed so freely from her mouth. And it really, really upset me. And I've just been on fire about how like it's such a damaging perception, when in all honesty, like Alaska is still in the United States, and there are so few places, there's still rural places, but there's so few places that force people to leave their community and live in a strange community without their family for over a month in their most vulnerable time of their life. So if we're not bringing care to our people, and if we're not bringing equitable care that is anti-racist and actively questioning the systems of power, then we are failing. And like Amana's coworker, Dr. Shimizu says, we always talk about our learning community. We are doing as well as the person who's doing the worst. And that's not said, that's not exactly it. But like if someone's sick and suffering and hurt, if someone's not getting prenatal care, that is our system's fault. It's not their fault. And it's not that they don't care about their health. It's that we have inequities that we need to right. And it's like you said, these conversations, confronting racism in our healthcare, standing up against the system and righting wrongs, like that's our community's job. So I love having this conversation. I'm so excited, like Celeste said, these connections we're going to build upon and really be actively anti-racist in healthcare to get to that equity. And it will take all of us. It's going to take these hard conversations. It's going to make people uncomfortable to challenge them in their biases, but they exist. And it's going to be something we'll get to together. So yeah, thanks for letting me share.
Brianna, Masi, thank you so much. Abra, it's wonderful to hear those words of truth about the need for a systems change, and humanizing medicine, I feel is what's needed. Focusing on what we need as real human beings, which is things like support, family, love, a sense of belonging, a place of being safe, maybe even access to land, access to intact land, access to healthy water, healthy air, these kinds of things. And you're right, it's going to take all of us at all different levels. And the people who are affected by the systems need to probably be involved in designing the systems. It doesn't seem that complicated, but it is, right? For lots of reasons that we're talking about. So those are some thoughts, but really focusing on the health, what is healthy, and getting away from the sick care system that splits folks up and mandates all kinds of things based on monies, right? I see someone's hand is up too.
Yeah, Nate, you want to ask a question?
Yes, I first of all, thank you so much for allowing me to speak. I was invited by Celeste, of course. Of course, she keeps me straight in terms of where I should be at. I'm not a medical professional, as you probably know, but I am in the community in a lot of different ways, a lot of different things, mentoring and stuff. But my question or comment, if you would be in rounds of, I work at the food bank every Friday, and I do a bunch of other little stuff in the community. Is there some mechanism or we can probably take a look at down the road in terms of trying to find some way to support those type of people, the homeless and the foodless people in those areas? Because I think a lot of great comments were made and a lot of great things point right directly to those people who are less fortunate. And we may want to kind of consider how we can help them equally, because again, it all starts there. And I see them every Friday in terms of sick, healthy, unhealthy, and such. So that is my comment. And again, thank you so much for allowing me to speak.
Thank you so much, Nate, Quiana, Masi. I wanted to mention there have been some really innovative programs in the Northern Great Plains, also where I've recently lived in North Dakota, that co-located primary care and food distribution. So increasing access to food by bringing the food distribution into clinics. And I think that's a really interesting model that has a lot of potential. So it doesn't necessarily have to be a clinic. It could be someplace where people are going, or a mobile thing that brings food to them, right? So just other ways to think about it. And I have some medical students that have been partnering with organizations to help evaluate and develop those types of programs, if that's ever helpful for you. Thank you, Masi.
Thank you.
Just then my brain started, as you shared, Allison, I'm thinking, wow, we're just getting that equity center up, which is downtown, we've got a lot of transit. So maybe there's an opportunity for us to, I don't know, I'm just brainstorming here. And we all know that racism is a public health crisis. We stress out about all these things that are done to us, and then we're sick. I mean, there's, stress. And so I just wanted to share that. And also a comment about the cancer screenings, and again, I might tear up because this is personal for me. I think about my mom who continuously went for screenings for bleeding, and she regularly get her checkup and get screened and nothing. And she passed away in 2019 from cervical cancer. I don't understand that.
Go ahead.
Thank you. I have a question. Thank you all so much for speaking. This is such a great conversation. And I think, Nathaniel, I think you just made a really good point about like intersectionality and the way that like our work, the disparities are so connected, and therefore like all these solutions are so connected. And I guess this is a question for panelists, but also just like anybody who's here. As we were building out this agenda for this like just chat today, it became so clear that there are voices like missing from this conversation. Even though we have so many great voices in this room, this conversation could go on for years probably if we just all kept sitting here and inviting in voices. And so like unhoused folks, that is like one part of health, right, that like I think needs to be addressed. And so I think if we like continue having this health conversation, which other voices would we need to include? And I think of like gender affirming care, that could have been a whole other hour we could have included in this conversation. And so even if that's just in the chat, or like if anybody has thoughts that they want to come off mute, who are we missing and who can we include in the future?
I'll just quickly come off chat to say, Celeste, sorry for your loss, and like not believing people, that's a huge part of it. Just quickly going back to the racism aspect of healthcare, and not listening to people when there's things that are wrong with their body. That I have a chronic illness, and for almost a year, I just didn't get answers. This was in New Mexico. This was not in Alaska. Yeah, so believing people when they're having issues, and that's going to be a big factor. But the voices too, like I mentioned earlier, like representatives from our different communities in Anchorage. Alaska, Anchorage is always going on about, it's like, oh, Anchorage, Alaska has the most diverse school districts. And so we know Anchorage is very diverse. So getting those people involved in places where we're sharing information, like in spaces like this, including those voices, having representatives from those communities there. And just like Dr. Kelleher shared, when we're making decisions for populations, having them there. It's so basic, but it just doesn't happen. So yeah, including stakeholders in making choices for how they receive their care. So important.
I guess I would just like to add, and I really just love this conversation, and thank you again so much. I would just add that the voices of workers are really important, because they are also kind of on the front line of experiencing illnesses that can be prevented if we cared for their health and safety. And also, I mentioned community health aides. There's so much knowledge and wisdom there among the community health aides. They are witnessing things firsthand, and their knowledge and experience is so important. And certainly hearing more from our youth, because from an environmental health perspective, often they are experiencing harm at greater rates than do adults. So that would be my 2 cents. And then I also just wanted to say, going back to your earlier question, Michaela, about building the good, and I loved what everyone said about building unity and connections. And I do think this conversation is really a great one. And I think someone said it in the chat, Richard said, together we're stronger. And I think that's so true. How can we support each other's efforts here? And really address the foundation of the problem and dismantling racism together, which is I think the foundation of so much injustice and health disparities that we're talking about today. So as far as building the good, I just want to also say that there are so many safe alternatives, and we need to hold industry accountable for safe alternatives so that mothers don't have to worry about what their children are exposed to when they go outside or in their home, or workers that are just trying to do their job and yet they're exposed to really harmful chemicals. So there's this whole effort around green chemistry. So that's another part of the transition that we need, in addition to addressing another existential crisis that we all know, which is climate change. But we need to transform the system of laws that we have so that they are more, they're fully protective of women and children, because these chemicals can be passed from mother to child in her womb and through breast milk. So we have to have a long view and truly protect future generations together. And I'm just really inspired by what everybody said today. Thank you.
It is so special to have folks from different sectors, different organizations, different peoples who might not often interact, and be able to see that we're all being affected by the same system, even if we're being affected in different ways, and we could fight it together. So with about 12 minutes left, we do have some updates that we'd like to share, ways people could get involved. But I'd like to offer, if anyone has any final words they want to share before we move on to those updates, please do.
Hi, everybody, I'm back. Just needed a moment. Anyway, again, I just wanted to say how this has really touched my heart, this whole conversation. And I'm looking so forward to partnering on, and not just talk, but some action. We really need to do this. So those are my comments. Thank you.
Yeah, I just want to really express my appreciation for the work that you're doing and bringing us together. And I think, yeah, as I had already pointed out, you know, we need to connect more and work together. And even if it means to, you know, I come from a research background, so, you know, like doing some research work together. Because I think being able to document is important, showing the numbers and the evidence behind the issues that we feel connected with, right? And I think if we do it collectively, we have a strong voice. And yeah, as Alaskans, as a community, a BIPOC community, maybe working together on even common projects, like let's say, for instance, research related projects that we can work together. So
yeah.
Hey, Michaela.
Yes.
This is Nate. I didn't want to be remiss if I passed this opportunity up. I see Santa Claus is on the line, and I wanted him to know he missed me during Christmas. So I didn't want him to get past not knowing he missed me.
Hi there. I didn't miss. I always keep you in my heart. We all have to have that sort of balance in life. So my heart goes out to everyone here. Thank you so much for addressing these challenges that we faced. I look at it from a point of view of how it affects children in particular. So as you might expect. So sending you all my love. Thank you so much for this opportunity.
Ho, ho, ho. Thank you. Thanks so much for coming and speaking. So I will now pass it over to Adam here, who works with Alaska Community Action on Toxics, as well as with the Just Transition Collective, to share some updates and ways to get involved.
Thank you so much, Michaela, and thank you everyone for being here. Some really great conversation. And yeah, thanks to Santa too. I wish you would have won your in your election, but you know, it happens, you know, some people don't believe, right? Anyways, yeah, let's get right into it. So I'm sure everybody has seen some of the anti-LGBTQ legislation that's being proposed, some of the harshest House bills, House Bill 105 and Senate Bill 96, which would forcibly out students, attract trans youth, and attempt to erase LGBTQ plus children and families from schools. Even harsher than Florida somehow, which is really messed up. So we're urging people to contact their legislators to pass HB 99, which is an equality bill, LGBTQ plus equality bill. And yeah, it's super destructive that, you know, the Dunleavy administration would even try to pass this stuff, because it's nasty business. I will say too that we'll have links to everything. Glow, thank you so much. But we'll also provide updates via email too on ways you can support this stuff in case you missed the chat. So and that's the big thing, right? That a lot of these coalitions in our collection are uplifting because it is such a big deal. And Planned Parenthood has been all over it of Alaska, you know, trying to stop some of this really destructive, just harmful legislation. It's really embarrassing. So definitely contact your legislators. So we'll provide links with that. That's the big thing that we want to uplift right now, because it is such a big deal. But, you know, I think if we raise our voices together, we'll have kind of more of an impact. So more information on that after the call as well, sent to your inbox. Also, the Renewable Energy Fund is set to expire this year. However, there's a public testimony actually in about 10 minutes to talk about. It's in the House Finance right now, House Bill 62, which would extend REF until 2033. And so far, the REF has provided more than 100 operations for renewable energy projects, saving communities 30 million gallons of diesel since 2017 alone. This is according to the Alaska Climate Alliance. And it's just a great way for Alaska to invest in their future. And that's one of the big things that the JTC is pushing, you know, moving away from an extractive industry to a renewable one. How do we do that? With legislation that promotes some of these renewable energies. And so if the REF expires, that's a big deal as well. So that's from the Alaska Climate Alliance, and they're doing a lot with public testimony and getting voices involved to keep that REF going to promote our next future. So more information on that. Thank you so much, Glow, for dropping that in the chat. Those were the big two. However, there is some great stuff going on from our other coalitions, specifically the Fairbanks Climate Action Coalition. Tonight, they're holding an energy info session in Fairbanks, if anybody is out there. Their big thing is discussing current energy and opportunities to engage renewable energy future. So more of that same thing, right? Envisioning a sustainable regenerative economy is one of the big JTC frameworks that we work to uplift. So come with questions about, where does your energy come from? Why is it affordable? Why is it not? Can we even have renewable energy that is affordable? And that is from 5:30 to 7 p.m. It's an in-person session. And yes, there's a Facebook event right there if you have any more questions on it. Election season, right around the door. So the Alaska Center is looking to support candidates who will move Anchorage with honesty, integrity, and compassion. They have some really great events going on this month, specifically on March 29th. They have a Lit and Learn election kickoff. That's from 6 to 7 p.m. And then they have an April Fool's door knock is no joke, which is on April 1st at noon to 2:30. So yeah, Alaska Center, another core collective member of the JTC. And one thing I do want to plug before we get off the call, I know I'm kind of bumping up to time, is the Solarize Matsu info session, which I believe is this evening at 6 p.m. In Palmer, Alaska, at the Valley Annex. And yeah, looking to solarize the Matsu Valley and put that solar energy in the hands of people who live there and making it more affordable and accessible to home and business owners. So yeah, that's I know I just rapid fired all that at you. Glow is typing quick as she can. So I really appreciate it. But those are the big March stuff that is on our agenda. So yeah, again, thanks for everybody for coming out. It's been such a productive call, and I love the diversity of the backgrounds people come from and how it all interconnects to really kind of just amplify the JTC framework, whether it's intentionally or kind of just organically. I feel like a lot of these values kind of just align with the JTC framework. So yeah, I've been talking for a while, so that's what's going on in March. So thanks again, everyone. And Michaela, I'll pass it back to you.
Thanks, Adam. Okay, I have 2 more updates. Sorry to keep you guys on. I just wanted to plug, for one, you all may know about the Willow project, which ConocoPhillips is wishing to have approved. It was said that this project could be approved as early as Monday and still no word. And I think that's because we're doing a great job at resisting the project. So please take a look at this last link that Glow just put on the chat and sign a letter to take action and tell Biden not to approve this project, because as a president who is wanting to be a climate friendly president, this Willow project would lock in more oil and gas development for 30 years. It's as much as 66 coal plants in one project. So please take action on that. And finally, I have a shameless plug. I'm the author of a book called Whelp, Climate Change and Arctic Identities. And I'll be having a book talk at the Anchorage Seed Lab connected to the Anchorage Museum on March 21st at 6 p.m. And I would love to see you all there to talk about climate change and how systemic racism and colonialism are related to climate change. That's the big theme of the book, and talk about my travels around Arctic. So thanks, Glow, for posting that. That would be the updates.
I'm gonna say one more thing. First, Michaela, that is freaking awesome, and I definitely need to scoop a copy of your book. Maybe have you sign it. I don't know if you're doing book signings, but
Yeah, sure.
One more thing too is I know Pam touched on about PFAS, per and polyfluoroalkyl substances in our water. We'll be in Juneau next week fighting for protective amendments to Senate Bill 67, which would phase out PFAS from firefighting foams, but we believe it's not strong enough to protect Alaskans. We want the DEC to have enforceable drinking water standards for PFAS in Alaska. So I'm going to drop the link right there. There's the petition if you want to go ahead and sign it to provide Alaskans with clean water. And thanks. A shameless plug from ACAT.
Great.
So can I just quickly add one more thing? I'm just
For
really
sure.
pleased with our Anchorage Assembly for passing ordinance 2023-17, which makes Juneteenth and Indigenous Peoples Day holiday. So just wanted to add that. Thank you, Assembly members.
Yeah, that is great work. There's always so much work to be doing, as you can tell with all of our updates. It's a really active community, and I'm just so blessed to have so many leaders in this room, so many folks who care so deeply about their communities and are acting on that. And so with that, we will end on time. And I appreciate all of you for being here. And I hope to see you next month at our next JTC monthly gathering. All righty.
Thanks, everybody.
Well, thank you.
Thank you all.
Thank you.
Bye-bye.
Thanks. Bye-bye.